to TLC 10 Life Community Podcast, where we dive into the heart of our local community, its wineries, restaurants, business, and some real estate. I'm your host, Troy Anderson, along with my co-host, Pamela, and we're here to bring you a new perspective on what's happening in our community. This week, we also have a special guest, Gwen Tagulao, with Benefit Solutions.
Yeah,
welcome to the show.
That was awesome. I was going to say.
Oh, good.
I have to. We were both practicing before we came on it, and he did it right. And I was ribbing him and saying he's going to get it wrong. But
No, he's got it. He got it down. I know. A lot of times I warn people, you just say it. Just do it. Don't overthink it.
Overthink it.
Yeah, if you overthink it,
Yeah, we just can't say it again.
That's okay.
Not get it wrong.
We'll keep practicing.
Yeah. All right, moving on. Okay, so as always, our first segment is Sipping on Success, where we open something local, and Troy wants to make as much noise as possible. He's holding the bottle right at the microphone. I think it's Annoy Pamela Day. So anyway, open something. It's Friday. We've got something delicious, I'm sure. Troy, why don't you tell us what you've got and why?
Tough cork. Dunham Cellars, which is a Washington wine. I don't have a tasting room locally, but I saw their Sauv Blanc, and I'm like, this is something that I don't normally see available. So Gwen said she likes Sauvignon Blanc.
I do. I'm not a big wine drinker. So
Okay.
that, just fair warning. That's why I was like, I want to just do, typical white.
Gotcha.
Fine.
All right.
It's a nice bright day, so a
Exactly.
nice bright wine is what we need. But I haven't heard of Dunham Cellars before, so I was quite surprised when you brought this in.
They're out of Walla Walla. They're known for their reds. They're big, bold reds.
Okay.
And they're one of the, I don't know a lot about them, but they are one of the, they've been around a while.
Okay.
Yeah, one of the founders over there in Walla Walla, along with Leonetti and Nicole.
All right. Well, pass the glasses round, Troy.
Okay.
Let's get on with this. So I'm going to let you guys take the first sip, obviously, so we don't have dead air. But while they're swirling their glasses and having a sniff and taking a taste, what I would say is it's very pale in the glass.
It's bright for
Yeah,
sure.
bright. It does have this kind of luminosity about it. I was going to say effervescence, but it's not that. It's this luminosity about it. It's not, some white wines I feel have like really yellow hues. Some are on that green tone. This is very
Darker
pale,
side,
like almost like a champagne kind of
Yeah.
feel to the colour of it. There's a little bit of legginess down the side of the glass. I'll just keep talking. You go ahead and try it. Troy's making more noises into the microphone.
Yeah.
It's good. Actually,
That is
I
good.
do like this one.
All right, so
Yeah.
you guys go ahead and describe it. What are you tasting? What's the bouquet?
It's very welcoming. I mean, it's just not too astringent, not too acidic. It's very smooth.
It's smooth,
Yeah.
A lot of times I feel like you have that aftertaste, right?
Yeah.
But this one's just smooth.
Yeah.
Yeah, it has a real softness to it, almost like a roundness on the tongue. It kind of envelops. It's not, like you said, there's no astringence to it. There's no sharpness. It's not dry. It has a slight dryness on the tip, of the tongue. But other than that, it has a real nice soft feel to it. It's actually quite complex, for a white wine.
It is.
I'm not sure yet what I'm tasting.
I was gonna say I'm not used to. This is my go-to drink, honestly, and I am having a tough time because I'm thrown off a little bit. It's not your typical white, so that's
What are you doing to us today, Troy? You picked a winery that we don't know about and a wine that we're struggling to describe, which is a good thing, I think, because sometimes if it's too easy, you kind of just I'm just going to drink it. But if you have to really think about it, you maybe savor it a little bit more.
Yeah.
Well, you're more of an expert than I am, so tell us what you're tasting.
Well, I'm tasting, the Sauv Blanc is known for its particular smell, which is grapefruit. Sometimes they say it smells like cat pee.
Did you really go there?
Yeah, he did. I was like, after I was sipping that, I was like,
I'm like, no, I don't want to drink
smelling
it.
Yeah.
I will attest, it does not smell like that.
No, it does not. No.
It's got the grapefruit smell, though.
There's a little bit of melon in there
Yeah,
too. I
yeah.
think that was what I
It's a little
tasted
sweeter.
first. Yeah, it does. It's
like
not
a slight citrus somewhere in there.
Yeah, you can taste the grapefruit. There's maybe even a hint of pineapple in there, but
Okay.
the overwhelming one was that softness of that like cantaloupe for me. I don't know if
Okay.
those things normally line up
That's
in
true.
flavour,
Yeah.
but
It's not too
Cantaloupe.
sweet.
cantaloupe, yeah,
Yeah.
It's sweet enough, but
Yeah.
not. It's not that kind of syrupy dessert wine.
Exactly.
It's definitely
Yeah.
just. It's bright. It's fresh as you know the kind of colour in the glass. I think the taste goes along with the way it looks.
Yeah,
Yeah.
I
Okay.
think it's very good.
I think this might be dangerous drinking this on the show because I'm like, okay, I've already had 3 sips and normally I've
I
had
was
one
gonna
at this
say,
point.
yes, it is. Can I
Well, there's
say
more.
it?
There's more in the bottle.
Can we find out what the alcohol was?
Yeah, I know,
Yeah.
exactly.
I was
exactly.
looking at that. What it should say,
This this would be really nice.
13 and a half. So it's a,
Pounder.
Porch pounder.
Ah.
Oh, yes, Gwen.
I was like, this seems like a nice, porch pounder, a nice day.
I like it. You know, that just goes to
day.
prove that Gwen does listen
I
to the
do.
show.
I always am looking for whoever's going to say it, either Troy or the guest. Or
Today the guest says it.
Yes.
I love that. Okay.
I was reprimanded for saying it. So
By your wife.
yeah, she's like, I think that's jump the shark, Troy.
I still don't understand what jump the shark means, but never mind.
Back in the days, it's showing my age, there was a show called Happy Days.
All right. Okay.
And
We didn't talk
the
about
Fonz.
this. Yeah. Okay.
One of the later episodes jumped the shark. So
Okay. I
that became
remember the program.
term in the industry when the show's
Ever seen
done.
I might be too. I'm 29, so I don't know
Oh,
how
okay. Thanks, Gwen. All right. Supposed to be moving on to the oldies.
Happy
I
Days.
don't know if you can edit that out. But
no,
yeah.
it's fine.
Just kidding.
I've seen Happy Days. I just don't remember the shark bit. So anyway, all right. Well, it's clear that we're already having lots of fun, and we're going to continue to enjoy this wine. But before we do, we're going to take a really quick break, and then we're going to come back and talk about all things. Dare I say it? Health insurance.
Man,
I
everyone's
know.
favorite topic.
I know. But
Yeah,
you know what?
especially this time of year.
Exactly, as we go into open enrollment. But Gwen's going to make it interesting for us. So, and she, with her bright personality. So,
Get exciting.
yeah.
Yeah.
So stay tuned. We will be right back.
Welcome back to TLC, 10 Life Community Podcast. And we're going to dive into all things health benefits with Gwen at
Well,
Benefit
such a dirty
Solutions
word,
Northwest.
isn't it?
I know there's that bad taste when people say insurance, right?
Yeah.
And I get
definitely
that
a
face
four-letter
all the
word.
time. Yeah. Yeah.
Nothing personal, Gwen.
No, trust me, I get it. I understand.
So before we get into the nuts and bolts of health insurance, tell us a little bit about you and your journey, what led you to Benefit Solutions Northwest, and what your day-to-day looks like as the account manager.
Yeah. Well, I'll start with, I did come from the Philippines, so I did migrate here a little while ago. Yeah, over 15 years ago now. And so, moving here gave me opportunities, opened doors for me and my family. And so,
Nice.
I really take opportunities really to heart. I have some big goals.
The American
in life.
dream.
Oh, yeah, exactly.
Yeah.
The American dream. And so that definition of American dream, I'm really living it. So
Cool.
I really am here. So, and I ended up, going to Ballard High School, UW as well. Sorry, not sorry, Troy. Go Dogs.
Cougs, Apple Cup's coming up.
I will
Apple
point out
Cup
though
is
that
coming
Troy
up.
is wearing a purple shirt
He
today.
is wearing purple shirt, so I think Go Dogs. We're here. He probably wore it for me. We'll go with that.
I have new respect for the University of Washington because
Yeah.
they staff Harborview.
Mm-hmm.
So, yeah.
Yep. Yeah, so I ended up going to UW right afterwards. I worked at a provider office just right after I graduated college, and so I worked with providers for many years, and so I dealt with a lot of back-end stuff. And so my role at the time was a patient care director, and
Okay.
so I was in charge of a lot of processes at the front. I also helped our billing manager with billings and claims issues really that we see firsthand, that the patients come to us and we're like, okay, what's going on here? We'll figure it out. I also educated a lot of our patients at the time about their benefits. You'd be surprised on how often people don't know about their benefits.
Yeah.
And so just really the education part, I learned so much in that space of provider side that I was like, I was figuring out what's next in my career, what's next for me. And so I was like, there's got to be some sort of career that you talk to people about benefits, right? And figuring that out. So I ended up, getting my license in life and disability, and after that, I was really able to, go deep into the insurance world, and that's when, there's so many, it's such a complex world. I'm learning every day, and so that's how I ended up, doing things, working with a agency that was a little bit smaller, and then at the time, it didn't work out, but then I did things on my own, learned this, industry itself. Man, I learned the hard way, and so, but that's how I got introduced to Benefit Solutions Northwest as well, is that, we got connected just because of fellow agents, and then all of a sudden, they were like, if you're interested in joining a team, you're done doing things on your own, let me know. And so the owner, Eric Cantor and Chris Berry, the moment I met with them, the first time I was like, yep, you guys are the one. It's one of those things. So so that's how I got it.
I like that you didn't just jump straight into that. You have that background where you've seen it from, from the side of the consumer and what their needs are. I think that's super important.
Oh, for sure. It makes you understand what's going on, because it can be just overwhelming.
It's overwhelming. I mean, I deal with it every day, and there are times where I'm like, this day it's an overwhelming day for me, right? So it happens. So, but as an account manager, every day's different. Whether it's coming from enrollment changes, terminations within companies as well. That's another thing. Even such thing as a business closing, right? What are we going to do for all these employees' benefits now? And so we help with that transition as well. So we're very hands-on agency. And so we like to do just making sure we're building a relationship beyond just the insurance. So
I like that.
That's awesome. So before we dive deeper, we understand Benefit Solutions Northwest is going through a bit of a rebrand and will be soon known as Anything Insurance. Can you share what the transition means, how the different sides of the company all fit together now?
Yeah, so BSNW, Benefit Solutions, just for short, it's a mouthful, so I'll just make it short. BSNW, that is the medical side of things for us, so employee benefits. So think of medical, dental insurance, vision, supplementals, so that's the side of our company. Anything insurance is the property casualty side of things. And so, think of home, auto, commercial insurance, really, so that's the side of our company. As we are growing and being successful, a lot of things that's happening right now is, a lot of our clients are asking, can you do other insurance? Do you offer other insurance? And so we pivoted and be like, okay, this is happening very often. So what can we do to continue building those relationships with our clients, again, beyond insurance, right? What can we do to help out? And so we're able to do that in that sense. So it's awesome.
Oh, perfect.
Yeah.
So it's kind of, it's an umbrella for it, right?
Exactly.
One-stop shopping for all your insurance.
Exactly. And so in the new year, it's anything insurance, take it as it is. I always say it's anything insurance. So
I like that. Okay. All right. Well, I mean, there's a great tagline there that you came up with, but your company does have its own tagline, which is a fresh approach to healthcare. And healthcare is primarily what we're talking about today, because I think, we can go in all sorts of different directions, but this is one of those subjects that people are confused about, and it's it can become a kind of boiling point for people where they're unsure of what to do. But so a fresh approach to health insurance, for those who aren't really familiar, what does that really mean, and how does it change the game for businesses here in Woodinville and beyond?
Well, like I said, we're a very hands-on company, and so we like to get to know each individual, not just the employers but the employees and individuals overall, because we're talking about really vulnerable conversations, right? We're talking about really medical history and stuff like that, depending on who you're talking to and what clients I'm working with. They have different needs, and so for us, we do one-on-one conversations just to make sure, hey, we want to make sure that we're taking care of you, deeper again than just talking about your benefits, talk about your deductible and stuff like that. And so we do one-on-one conversations, doing advocacy and just education. How do you use your benefits, right? Every renewal we do one-on-one conversations with employees. Let's talk about an insurance, whether you're switching insurance or staying in insurance. A lot of times there's so many changes in insurance, you know what I mean? Every year. And so a lot of times just going through the changes, talking about it, and educating them about it is good. Another, fresh approach that we do is we also utilize a lot of technology as well. So we try to integrate, payroll in the system just to make sure, because a lot of times, there's payroll deductions. that employees are needing to pay for their benefits. And so we help with that in the sense, a more, diverse opportunity for us in like different areas of the company. And so we're able to assist, with HR if we need to. We're not an HR company, but, we have partners, and we also have like just specific, products of our own as well. So we're able to integrate on the specific needs of each company.
Okay.
So yeah, and like I said, going back to the one-on-one conversations, a lot of our clients are within the trades. We have a lot of clients who are Spanish-speaking individuals. I came from the Philippines, so I talk Tagalog, so I speak the language, and so we provide those kinds of services. And so if you have employees that are particularly Spanish-speaking individuals, we can cater to that. We have Spanish-speaking benefit counselors that can talk to them to really ensure that they can understand it, because as a bilingual person, I totally understand the confusion. I mean, insurance in general is already confusing,
Right. Put a language barrier in the way.
Exactly. You put a language barrier in there, and it's a whole lot. So yeah, we really cater to that, and just making sure, again, going beyond insurance, right? Getting to know them. So
I know I was impressed first time I sat down with you and your boss, Eric, were putting a package together for the chamber. And so, traditionally only big corporations can customize benefit packages. Now you're bringing that opportunity to smaller businesses. Can you walk us through what that, how that works and why it's such a win for local business owners?
Yeah, so a lot of, businesses that are larger businesses that have 5,000 or more employees, a lot of times they're self-funding plan, right?
Okay.
They're because they have such deep pockets that, they don't really care much about the fixed monthly income or monthly premium that they're paying. And so with bigger corporations, it's self-funding. And a lot of times they purchase what's called a stop-loss insurance. So what we specialize in is what's called level funded plan. And so this introduces small to medium-sized businesses to that similar plan. The plan that's customized, you go through underwriting, so you're able to customize specifically the plans that tailors your specific employees, if they have specific health issues or not at all. If you have a younger, individuals in your team that are healthy, these are the kinds of plans that you want to get into. Because with level funded, you know exactly where your money's going, and as an employer, it actually gives you an opportunity to get some money back. So the difference for level funding compared to a fully insured, which I call the traditional health insurance, you know where your money's going in the level funding. You pay into 3 buckets. With fully insured, you're writing a check, right? And then you're sending it to the insurance carrier. You don't know where your money's going a lot of times. And so with level funding, you pay for the administrative costs. So again, pretty straightforward. That's admin work. So, that pays for member ID cards, ordering those. That pays for us as a broker. That helps you as well. The second bucket you pay into is that stop loss insurance, like I said. Think of it as a safety net as an employer. So think of any catastrophic event that may come up within the year, because every year is different. Some stuff comes up. And so think of it as a safety net. The third bucket that you pay into is a claims account bucket. And so what really that does is that, you're pre-funding this claims bucket account throughout the year, right? Pretty straightforward with the claims bucket. Once you go through a doctor or have a claim, the TPA, also third-party administrator, will dive into that bucket, pay your services, and then so that's the 3 areas that you pay into within the premiums. But the beauty about it, though, is that you can get some money back. So let's say that claim bucket account that you're pre-funding every year, let's say you have a healthier group, like I said, younger, healthier group, not using any claims. That pre-funding account that you're pre-funding, you can get that money back. And so depending on which carrier, let's say, you had a $30,000, let's say, pre-funding account that's still there, still available at the end of the year, you can get that money back. And so just depending on the carrier, it's a little bit different, but it is confusing though.
Seems a little more transparent though.
Yeah, it's pretty transparent, absolutely. With level funding, you know exactly where your money's going as an employer, so you can figure out, our claims coming through, like, you know, or what kind of benefits are our team really using? You know, is this something that, you know, that are suited for us as a group?
And if you use all the funds in the claims bucket, then that's when the stopgap comes in?
Exactly.
Okay.
Yep.
Yeah,
That's
makes
when
sense.
stop loss comes in. Yep.
So just to kind of carry on that conversation, we talked about the 5,000 versus smaller. Is there a cap for this kind of thing that you're talking about? Because I know there are some people that are self-employed, right? Or there'll be one or two of them, and a lot of those companies can't get insurance. They have to go into these funds. So that's different from what you're talking
It
about?
is different. Yeah, it is different.
Can you kind of just tell our audience a little bit about that, where if somebody's self-employed and they're less than 3 employees, I think it is, right?
Well, self-employed a lot of times are just individuals that are self-employed. Or a lot of times don't have, you know, employees. And so with, you know, a lot of people get confused with the individual policy versus a group policy. So a group policy, a lot of times, you know, you need at least 2 people. And so with self-employed individuals, a lot of times they don't have employees. And so that's kind of a little bit of a difference about it. With self-funding or level funding, excuse me, you need at least 2 employees.
Okay, I think that's where I was getting
Yep.
at. Whereas if if you're two, it's a certain kind of point, right?
Yep,
And then above
exactly.
that, there are other options available to you, and then you guys have access to all of that information. And can't remember if I'm right here, but if it's two people, it's kind of like there's a whole bunch of people in a pot that go for the insurance.
Yeah, so think about it this way, like a lot of times insurance is just risk, right? The more people you have, the more like spread out the risks are. But if you only have 2 people, the risks are against those 2 people. So
Right. So you can buy into a group, I guess is what I'm...
yes,
Yeah.
yes, yeah.
Okay.
Yeah, there's other options. For
Yeah,
you.
and I'm
Yeah.
sure if we talked about that, we would be here all day. So, you know,
I was gonna say,
that's a
if you
great
wanna go
segue
into
to-
the weeds of
yeah,
things,
you
you
can
know,
call
we
Gwen,
can.
and she can go into the weeds with you about that one. But
Anytime, yeah.
yeah, I think you know one of the biggest concerns that people have is it comes down to money, right? So healthcare costs just keep going up, and that's something that we're all feeling. Whether you're a business owner or you're buying your own plan, what's in your guys' opinion, what is really driving up these increases, and are there any strategies or creative solutions that you're seeing that can help manage those rising costs? Because I'm the same every year.
Yeah.
I know every year we get our our information, and we're like,
What is it
now
this
my
time?
deductible's this now, and I'm paying for the privilege of maybe going to the doctor.
Yeah, and you do the research, right? I mean, a lot of times it's the education. I go back to the education a lot of times, like going in network and out of network, right? And so when it comes to the rising costs, right now, everything is rising. That's one factor, first of all. And second factor, hospitals and providers aren't getting paid enough. Right now, every year you have your contract, negotiation between, the hospitals and also the insurance carrier. So that's one factor into it. A second factor is prescription drug plan. Prescription drugs in general. As you know, weight loss drug prescriptions are high right now. And so, but when you think about it in a bigger picture, America in general is actually just known for a non-healthy country. Yes. And so when you think about, weight loss drugs, and these are very popular, and then but people don't realize how that impacts the overall market.
Oh yeah, I just had to pay for my son's Avicue. Insurance doesn't cover it.
Yeah. So
It's an EpiPen, but it's not an EpiPen. It comes in a small square that you can put in your pocket. But yeah, that was fun.
the definition of there's such complex world in the prescription, in the pharmacy in general, that you always want to make sure that you educate yourself on what kind of benefits are you offering, little things like going over the prescription drug plan, just like you mentioned, every year, is this particular plan that I'm going to switch to will cover this or not, and just comparing it.
So that's kind of the strategy point, is really thinking about what are you going to use from your plan.
Absolutely.
Right? And you talked about that, obviously providers aren't getting paid what they maybe were, so their costs are going up, but the insurance costs are also going up. Can we talk about that just a little bit more? Because it seems to be a little bit of a disparity. Is the insurance just going up because because it is, and that's just the fact of it. Even though the providers aren't getting paid, they don't seem to be getting the increases, but we're paying more for our insurance, right? Is there a reason for that? I know some of that will be some of the funding that's being taken away from the government, but this happens year on year, so
that's a gray area, right? Because a lot of times there's so many layers into why everything is going up and why specific insurance carrier, right? Think of it as the demand for care right now when it comes to, chronic pains or just in general, just overall like services that you're looking for, it's very high demanding at the moment. Okay. And so a lot of people are like, I want this, and I want that, specific things. And so a lot of times when consumers are in need for something specific or something that like insurance, you look at it as think of it as a bigger picture of everything is rising. It's just a domino effect. If everything in the hospital and provider side of things are going up, that means the things that they're billing on the back end to insurance carriers are also going up. And so that's kind of the domino effect,
Right.
that
so basically what you're saying is we can do nothing about it. But, however, there
all these
might,
insurance carriers, they get it all.
There might be some strategy. So you talked about, prescriptions. Is there any other things that people can take into consideration when as we go into open enrollment, when they're making those decisions? What strategies can they employ to kind of keep those costs down, other than the prescriptions?
Yeah. Again, going back to look at your current plan right now. What are the things that are changing? Even so little as explanation of benefits, looking into your explanation of benefits. I don't know if you guys know, but a lot of times there's a lot of errors in billing when it comes to the provider side. So that happens. It happens more often than not, actually. And so what I always recommend people to do is, look through your explanation of benefits, right? Look through the type of plans that you're offering or you have right now. And so it really all depends on navigating through, what kind of resource you have. Like I always say, partner up with a broker like us, or partner up with an agent that specializes in a specific area. Let's say if you're an individual, partner up with an agency that specializes in an individual plan and see how that goes, and making sure that you're really reading through the fine prints. I know a lot of times people don't read through the fine prints, but that's why you go to an agent, right? They do read the fine prints. And so navigating through that and making sure, this fits well for me and my needs in the next year.
Well, looking at what you used last year or what you didn't use. So do you need that going forward? And is it based on your age and, how many people are in your family and all of those things? But it's always better to get an expert involved, right?
Oh yeah, absolutely. And again, the level funding space right now is entering a lot of small to medium-sized businesses because they're finding different ways of, different structure of funding, right?
So it's growing.
It's growing. Yeah, it's growing. Okay. So.
All right. Well, we'll keep on the track of money for a little bit because it's important to all of us. But as an organisation, Benefit Solutions, and it's going to take me a while to get used to it being called anything insurance, but we're just going to go with benefits for today because that's how we know you, right?
Yeah.
But Benefit Solutions actually promotes that businesses can save 10 to 20%, sometimes more, on their plans, which it appears to be, that kind of thing normally seems to be attributed to those companies that have 5,000 employees or more, right? So what are some of the common areas where you see companies overspending, and what questions should they be asking to make sure that their dollars are being spent wisely?
Yeah, so as an employer side of things, I always, take a look at other structures or other types of plan design a lot of times. And so a lot of money are getting spent on premiums, right? A lot of people don't realize that there's level funding or self-funding, right? And so educating yourself on what kind of, offerings are out there and what kind of new things are popping up is always good. Like I said, partnering up with agents or agencies is always essential. Get a licensed agent involved and just make sure you trust them. Build that relationship with the broker. Because a lot of times, business owners or individuals just don't have that relationship. And so isn't it great to be able to just call someone and be like, hey, Gwen, I've got something going on, or, something were to pop up, having a go-to person, a trusted, partner a lot of times, that helps a lot. And so a lot of people aren't spending premium dollars. Employers are entering the fully insured side of things, so they're paying a lot in premiums right now, even though there's a big network that they're paying into. But let's say you have like I said, a younger, healthier group that's not using that network. Right? And so what could you do? What could you save up? And so I would say premium waste is one. Plan designs, like I said, having those high deductibles, lower deductibles, with level funding, you can customize those. And so you can say, let's say you guys want, $2,000 deductible with 100% co-insurance, or even 80%, 75, something specific. We're able to customize our plans in that sense. So let's say, all of a sudden your group or your team are wanting to have a little bit more. I'm so sorry.
No phones
sorry
allowed.
about that. So anyways, the plan design, I'm so sorry. I got thrown off. I do apologize about that.
No, you're fine.
With plan designs, these are tailored specifically to with level funding. It's tailored specifically for those companies. And so you go through underwriting, you do have to qualify for them, but gives you an opportunity to have more hands-on within the design that you have, instead of this insurance company is offering this and that's all we have, right? So
I kind of like that, because if you work for a bigger employer, it's like, well, these are the 3 plans you can pick from. There's no customization of that. It's those are the 3. Pick one that best suits you. Whereas it sounds like this is definitely more bespoke.
Yeah,
Okay.
yeah. And with the plan designs, you can customize. Like I said, if all of a sudden your team has a lot of needs of mental health, like access to mental health, virtual care or in person, we can try to talk to our carriers, and figure out what other resources we can provide to our clients as well, in that sense. So we do that. And so again, just making sure we talk to our clients and talk about their specific needs is essential to figure out the designs. And so the questions that they should really be asking is, where are my dollars going? Are employees really using the benefits that we do have? Every year, just shop it out. Just make sure that you're comparing. There's so many tools out there that you guys can utilize in comparing costs or comparing plans, even AI. So
We might as well use the tools that we have,
Right.
right?
yes,
Okay.
yes, exactly.
Now, I think, the reason we're kind of, not the only reason we're having this conversation, but why we're having this conversation right now is because we are getting ready for open enrollment, right? It's right around the corner. So whether you're a business owner or just managing your own coverage, what are the top things people should be doing now to prepare, and what mistakes should they avoid? I think that's a really important question, because every year, things are different. So you can make repetitive mistakes, or you can make new ones.
I find it really hard to compare plans when you're looking at A or B. One does this, one doesn't do that, and it's like
I
get
you can just
lost
call
in the
Gwen.
weeds.
I was going to say, why is it confusing, Troy? Tell me about it. I can educate you on how to do it.
Just call Gwen.
But until they hear this show, they don't know about Gwen. So
Right.
Gwen, tell us.
Yeah. So for open enrollment, a lot of times, don't wait last minute. A lot of times people just don't know the dates of open enrollment.
And which are?
They are November 1st to January 15th. So if you are have a individual plan, or through the marketplace, open enrollment's coming up. So I would just recommend looking into your benefits. And so again, plan design. Looking through it, it is difficult, but again, partnering up with an agent that knows exactly what's happening in the industry, what's happening in the insurance side of things as well, makes a huge difference. And so, just educating yourself really at the end of the day about, what are these benefits, Yeah.
So November 1st is open enrollment, but can people I'm assuming can start
Now,
getting information about their plans
Exactly.
now?
Yep.
Right, so that come November 1st they can either be ready to go, or they're at least some way down that process of, like Troy said, comparing.
Exactly. Yeah. Just doing your own research, and a lot of times, a lot of people don't want to do the research.
Right.
But
Well, but that leads me to my next thing, because it's overwhelming, right?
exactly,
So
yeah.
and you're overwhelmed by just that you could make a mistake is one thing, challenging and comparing policy by policy. But a lot of that comes down to also the jargon that's used in there, right? So sometimes I don't know whether it's supposed to be that way, that they want to confuse you, but the fine print can be a little bit like, well, what does that mean in layman's terms, right? So what are some tips to better understand that people's plans and really maximize their benefits? I mean, obviously they can call you, but people are going to want to do a little bit of their research themselves before, and it's confusing when you hear all these terms that you're like, I don't know what that means.
Yeah, and I would say, using the tools out there, like I said, the comparing tools, like AI is one thing that a lot of people don't like to look into. But man, AI, there's some accuracy in AI, and it's actually entering the insurance world.
Yeah.
It's entering the insurance world where basically they're figuring out, specific claims, the accuracy of just data in general, just data analysis in general. So less and less mistakes are happening, which is great. On the billing side too, again, that's another thing.
Wouldn't it be nice if that saved us some money?
Yeah.
It would be nice. I mean, in general, unfortunately, insurance is not going down.
No.
So. But yeah,
What?
talking, yeah, pretty much. It's not going down.
Darn.
I know. But it's regarding tools, like I said, having specific, comparison tools. I know I say comparison tools a lot, but that's, the best tools that you can get is doing your own research at the end of the day, because not a lot of people are doing it. So educating yourself, advocating for yourself if you want to do it on your own, but I always recommend just go with a licensed agent because they know what they're doing. You can talk to several licensed agents even, plan ahead. Always plan ahead in that sense and be like, hey, open enrollment's coming up. I want to, handle this. And in the employer side, a lot of employers just wait for their broker to reach out to them. And so what I recommend is, reach out to your broker before your renewal comes up. Knowing your renewal date is another thing.
Well, I think also because if you rush to do it, that's when mistakes happen, right?
Right.
And you just pick something because it's like, oh,
Because I got to do it.
I've got to do it. I've got less than a week to figure this out. I'll just go with that one, same as I did last year. But it might not be, the right plan for you.
Yeah, exactly. And, increases are here. Like I said, being able to shop the market. So BSNW is a brokerage, so we're not tied to one specific insurance carrier. So we have access to a lot of carriers. We also even have our own products as well. So that's a little bit unique about us. So, again, figuring out, shopping your plans, just making sure you plan ahead, is super essential. I can't emphasize it enough just to educate yourself, because insurance is complex, but can be simple as long as you know the basics, the general information, right? And how you're able to navigate through the complexity of it. So.
Sounds easy enough.
Yeah. There's a whole nother segment of people that might not get employer coverage, like myself. I'm self-employed, so not everyone listening has insurance through their employer. Freelancers, real estate agents, folks between jobs even. What practical steps can they take to find affordable and reliable coverage during open enrollment?
Going back to connecting with the agent, right? I keep all these questions.
So you can help them with the open market, the Affordable Care Act.
Yep.
Okay.
I can help with that. Yeah, I am certified through the Washington Health Plan Finder, and so going even if you don't partner up with me, there are agents in Washington Health Plan Finder who are able to talk to you. Again, catering, going back to language barrier, they provide other languages as well to talk to specific people that can explain to them what the benefits are, what they're signing up for, because like I said, the amount of people that don't know their benefits, it's sad to me as an agent and in this world, just because you're paying into it, right, at the end of the day. And so using the benefits you do have is so just educate yourself, just being able to use it properly and accurately too.
Okay.
Yeah.
So those that don't have it through their company, not to despair. They can go on and look through the exchange themselves
directly to the insurance companies as well.
Right. But if they don't understand it, find somebody like yourself that does understand it. They can explain all that jargon and stuff, and don't feel like it's again the overwhelming world of healthcare, right? Of health insurance.
Yeah, and there's agencies out there that specializes in just individual market. And so, I don't specialize in specifically just the individual, or overall our company specialize in level funding, but I do have some knowledge in the individual space.
So you can at least point people in the right direction.
Exactly. So.
And you know what, she's really amenable, so just call her. She'll definitely talk to you.
You're so sweet. Oh, thank you.
Yeah, so I mean, the healthcare space is constantly evolving from telehealth to mental health coverage. You brought that up, to more flexible networks. What trends are you seeing right now that our listeners should keep in mind?
Well, telehealth, you mentioned.
I like telehealth.
Telehealth is great. Yeah. I agree. There are certain providers right now that are offering more virtual care specifically for chronic diseases, right? A lot of insurance care are trying to figure out what can we do to advance the virtual care space. At the time of the pandemic, virtual care was the pandemic solution. Yeah. Right now, it's not. It's everywhere, and some people actually prefer the virtual care.
Well, it's so quick.
It's so quick, yeah. And even so little, like a lot of times, like when you have some sort of like mild, symptom of any sort, even just a pink eye, you can go to a virtual care and pay $0 copay, right? Yeah. And so that saves you a little bit more to just do it in a quick 5 minutes instead of just going to an actual urgent care or emergency room. A lot of people go to emergency room right away, but I'm always like, if you can wait, go to urgent care.
Yeah, definitely. Yeah, because usually the copay is different.
Exactly, a lot cheaper.
Yeah, a lot cheaper, a couple of $100 cheaper for most people.
Compared to ER visits. So,
yeah. Okay, so we're probably going to see more of that telehealth, hopefully.
Yes, more telehealth, more mental health as well, more and more things in the virtual space.
So it's interesting, the mental health one, because that seems to be an area where there is a real need for it, but not necessarily enough providers that have in-office appointments. So we are seeing more of that kind of, I know I've heard on the radio of certain things, but I think that would be an area that if they can expand that would be really good. But also making sure that the people that are providing those services are spot on and,
Yeah, I mean, we go back to, we are known as a country that's not as healthy, right? And so that goes with mental health. Not a lot of people are moving. Not a lot of people are doing some exercise, right? And so that goes to mental health. It's a domino effect at the end of the day. If you're not moving your body, if you're not, even doing, your preventative care visits every year that are 100% cover, and it's like if you're not doing the little steps like that, as a society in general, we're wanting to be better, we're wanting to be healthy, and not known to be a not healthy country. Yeah. But at the end of the day, we have to take those steps to be healthier. I think I'd like to think that we're pivoting into a mindset that healthcare doesn't just treat illnesses, right?
Right.
Prevent them.
Exactly. Prevention, access, and making sure that we start ahead, we plan ahead. If you do have some health issues, you can talk to your doctors, kind of figure out, what are the best steps to do that. And so, partnering up with providers is essential too. We have Evergreen Health here. It's a community-based, facility. And so, like, little things like that. We have Rick, we have access to these certain, resources that we have in the healthcare space that we should be utilizing it. Yeah. And again, education is number one.
You mentioned the preventative side of it and doing those annual checkups.
Yep.
I think that's really important because then you have a baseline for everything. And I should imagine that will also help you figure out your insurance policies going forward because what's going on with your body and what's breaking down and what isn't. So what coverage are you going to need? So we've come full circle.
We've come circle, exactly. Now you're getting it. Yeah. And it's one of those things that insurance carriers too are providing wellness programs, like Fitbits, discounts to facilities. They're getting creative out there.
I'm sure people don't know that.
Oh yeah, they don't. And so that's part of our role as a broker or as like an account manager. We educate you in those wellness programs, and you can utilize it because there's at least like so many different wellness programs that you can utilize.
I saw one program or one policy I was looking at covered a nutritionist.
Oh wow!
Yeah, I was like, oh, that's impressive. They're starting from the beginning.
Depends on the carrier. Yeah. Depends on the carrier.
I might need that. That and maybe a Pilates instructor.
That would be nice. Insurance carriers, are you listening out there?
Well, the thing is, I mean, it is. It's all mind,
Yep.
health, and body. So
Yeah.
if you can do those things to stay healthy, then the insurance companies have to spend less on care.
That's exactly, again, we're going back to that full circle,
Yeah.
right? If you're taking care of
Yeah,
yourself.
because you
Yep.
mentioned, the weight loss drugs and stuff, and I know in the UK, obviously, healthcare is funded very differently in the UK. But I know there was some talk there of actually providing those injectables or whatever they are as part of,
Part of the coverage.
of coverage.
Yep.
Yeah. So rather than it being super expensive, because if they can get their weight under control, it means that they have less health issues later on.
Right.
So just thought I'd bring that up. But,
Yeah. Again, the prevention
Yeah,
is so essential.
exactly.
Like, preventative care is right in front of our healthcare system right now
Yeah.
because we're wanting to be healthier.
I think that's great. I mean, because we want to build a healthier community. So when we think about that, that role of affordable healthcare, how it plays into the community, like communities like ours in Woodinville.
Yeah.
What do you see? What can local businesses and individuals do to make sure we're all supporting healthier, stronger communities? You talked about exercise and stuff.
Less fish and chips.
Who's
right stuff.
hating on the fish and chips here?
Not I.
Not me either.
No.
Everything in moderation.
Yes, everything in moderation. But, I definitely see it as a foundation of a lot of things, right? Families thrive. Like little things like you have grandparents seeing, their grandkids, right? Or doing activities for their grandkids. If you're healthier and moving more, you're able to do that. And so the foundation of being a healthier community in general and more engaged to each other as well, even little with employees, right? Employers being more engaged with how they're doing, overall within their health, just because, mental health, it impacts a lot of people's, work a lot of times. And so to be able to be hands-on with your employees or hands-on with your neighbors, being like, hey, I was just doing this, come check it out with me, let's do it together. And so to me, I think moving forward to, again, prevention firsthand instead of we're treating this because, we're unhealthy.
Yeah.
Making sure we're proactive a lot of times just because we're getting lazier. We're getting lazier. That's what it is.
Yeah.
That's what it is. People are getting lazier. So.
Well, I think I would also say that kind of that building community, you're doing a lot of that because you are a member of the Woodinville Chamber of Commerce, right? And you're at virtually every event. So that our community has access to you because you're there in the chamber, but you're also at any events that the chamber holds, open. So the fun runs and things like that.
Absolutely.
Those are all great things, building a healthier community that way.
Yeah, and for us too, as a company, we have built relationship with associations, and so we have literally helped industries make sure that they're being proactive, just the way we're doing as a whole. Just being proactive in general is so essential to a lot of people, especially, like I said, a lot of our clients are in the trades, and so they're always moving all the time.
They're wearing different hats too.
They're literally wearing different hats.
Sometimes they're the janitors, sometimes they're the estimators,
Yeah.
sometimes they're doing the work.
Yeah,
So,
what I'm hearing though, Troy, is sitting down on our bottoms drinking wine on a Friday is not very proactive.
I will. Happy Friday.
Yeah, exactly. Happy Friday. It's not every day that we do this.
No. And, locally we're thinking, again, going back to like as a whole in Woodinville and beyond, partnering up with providers, local providers and things like that are like your neighbors that are living next to you, making sure you have those conversations and be open, have those conversations. Because a lot of times, you have conversations with neighbor and a lot of times how's the weather, this and that. So little
I think one thing we haven't dug into a little bit, and you mentioned it, Troy, was when you had that conversation with Gwen and her boss, early on about how they could help the Chamber of Commerce, when in fact really what that is helping local businesses that are under the Chamber of Commerce.
Absolutely.
We haven't really touched on that, but I wanted to mention it again so that anybody listening to this that is a business owner can connect with you via the Chamber of
Absolutely.
Commerce too, right?
Absolutely. As a part of the Chamber of Commerce, you do have access to these specific plans that we're offering. And so, being able to have access that, come to an event, talk to me, just to pick my brain,
Just another
there's no
benefit
pressure. Just
of
no
being a
pressure.
chamber member.
Exactly.
Just another benefit, Talk about insurance. There's an insurance nerd named Gwen.
I just wanted to make sure we highlighted that, because that's you as a company building stronger community.
Absolutely.
And making sure that everybody in this area, and it's not just Woodinville, it's
Exactly.
Woodinville adjacent as well, but
Yeah.
making sure that people have access to knowledge and information and resources so that we can all be healthier.
Absolutely, yeah. We, like I said, we're part of associations, right? We have these programs and chambers to ensure that they have access to this and introduce it to the community. Because again, a lot of times you don't do your own research, and so having access to a local person that shows up, everywhere you go is awesome, because then you can be like, oh, I forgot,
Yeah.
I need to talk to you about that. Reminds me, I will email you.
Yeah.
Certain things like that. So
Yeah.
having a trusted local person is always essential. So
I like that.
yeah.
Cool. You are definitely an asset to our community. Thank you so much.
Sure.
And that just kind of segues into wrapping the show up here with our favorite question. What does Gwen like to do in and around Woodinville? And what could be maybe a hidden gem for our listeners?
Yeah, I was thinking about this. I was like, "There's so many, so many spots." I'm like, "It's hard. That's a hard
I
question."
know. If you highlight one, someone else is going to get upset. Right?
Exactly. Yeah, I know for a fact Heritage has been mentioned many times
Yeah.
in this podcast, but if you guys haven't been to their breakfast, have tried their breakfast,
Oh.
have you guys been to breakfast at
I have
Heritage?
not. I've
Please
been for
try it
lunch
I've been to
out.
dinner.
brunch. Yeah.
Oh yeah, it's awesome. My partner and I went there just a few weekends ago, and it was lovely. We had a lovely
Cool.
time. It was
What
sunny.
did you have? What was your recommendation?
It was chilaquiles, like the Mexican
Okay.
little tortillas, and then it's got some cream sauces in there, and then it was really good. My partner, I'm trying to remember what she got. I believe she got eggs Benny.
Okay.
That's always her go-to. Eggs Benedict.
Nice and healthy.
Can't go wrong with that.
Nice and healthy. Exactly. So, and we had, we had a great time. And Bree's amazing.
Yes.
So,
Yes, we love Brie.
yeah. And another one is Four Stitch Brewery.
Brewing.
Oh.
Yeah, we went there for a happy hour just a few months ago, and we met the owner, Matt, and he does a lot of, I believe, just stand-up comedians every Friday or something like that. He has a show.
remember that,
Yeah.
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 Okay.
He also has some trivias and stuff over there. It's right in the corner. It's definitely a hidden gem.
Yeah.
Right over there. So.
Yeah, it's across the highway from Costco,
Mhm.
right?
Yeah.
Yeah.
Yeah. If you go to Kokanee, you've gone the wrong way.
Right.
Yeah. So those are the gems. Check it
Yeah.
out.
Cool.
I like it. I love
Yeah.
hearing what other people are doing.
Yeah.
Makes me want to get out and do more.
And do more. Yeah.
I want to do more
Start a
trivia.
list.
We can do more trivia. Yeah. Okay.
You know where to go.
All right. Well, as always, Gwen, it's always
Thank
a
you.
pleasure
Thank
talking
you
to
so
you.
much for
Before we
having
wrap
me,
up the
guys.
show, we'll come back and we'll get your contact information so that people can, ask you those pertinent questions and really dig into their healthcare insurance and really what works for them and their families and their employees. But before we do that, we're going to take a really quick break, and then we're going to come back with our real estate roundup. Okay, stay tuned. Welcome back to TLC 10 by Community Podcast. We've had a fascinating conversation about health insurance. I know that sounds like an oxymoron, but it isn't.
I told you I make it exciting.
Gwen, you make
It was
everything exciting. I mean, nobody can talk to you and not smile and find things interesting. So, that's a commercial in itself. So, but we'll come back to, like I said, the details of where people can get hold of you. But it's real estate roundup time. You ready?
Oh
Troy?
gosh. What is it this week?
Honestly, the amount of time I spend putting this together, he's like, "What is it?"
A lot of things change, I'm sure, in your world too.
Yeah.
I
every
know.
day.
I'm keeping it simple this week. So, as in the real estate world, more often than not, people think that the springtime is the best time to put their home on the market. So we're well past spring. We're at the end of summer. We're heading into fall. What people might not know is we know from experience that fall is a really great time for people to list their home, and it's usually less competition. So with that said, let's talk about some of the mistakes that potential home sellers make in the fall. and how to avoid them when they're putting their houses on the market.
Yeah, I mean, that's an excellent point. There is a little bit less inventory in the fall, so, the market kind of looks like a bell curve every year. You see more houses come on in the summertime and springtime, and so fall makes it, kind of the shoulder season, and you're going to have less competition when you're out there. So some mistakes that people do, they skip some of the exterior maintenance, like fallen leaves, clogged gutters. That can cause other things to get damaged as well. And if you're going to be showing your house, you don't want people slipping on the leaves, so you got to keep those cleared. And then, pressure washing sidewalks and decks, things like that, are still important in the fall.
Okay, so there's some quick fixes there. They're cleaning out the gutters and that kind of stuff.
Yeah, fresh mulch, and that always helps and has a certain smell about it that typically is fresh.
Maybe not the one that smells like manure then?
No. No. Yeah, we like the one that smells fresh. When you walk up to the house, you can kind of smell it a little bit.
Yes, it smells earthy, but not farmish.
I was going to say, not too earthy.
Yes.
Not poopy.
We're not talking farmyard. We're talking like walking the forest.
That would be a mistake.
Yeah. Okay. All right. Number 2. What else do you have?
Oh gosh. What else do I have? Maybe dark listing photos. We have shorter days, so in planning and scheduling the photos midday, even if it's raining and maybe a little gray out, we can definitely brighten those up with enhancements. But I've seen a lot of bad listing photos in my day.
I like the elongation there. Bad.
Emphasizing bad.
Yeah, and both is true. You see great listing photos, you get to the house and it's like, oh my gosh, this place is terrible. And then there's bad listing photos, you get to the place and you're like, oh my gosh, this is a hidden gem.
Yeah.
I'm glad you took bad photos. Now my buyer's going to get a good deal.
Okay.
Yeah. So and then scheduling it early.
Early in the season.
Yeah. Just plan ahead. Yeah.
Yeah. Okay.
So, and then another mistake could be like over decorating for the season. If you're, a Halloween type person and you've got big skeletons and witches and stuff in your front yard, it probably frown on that.
You might want to hold off that year.
Hold off.
Save it for the new house.
Just maybe put up some orange lights or something for ambiance. But don't want to scare people away.
Okay, so all right, so no Halloween decorations. So basically, any of that decorating stuff. Don't go too heavy
or if
on
it's
it.
Christmas time, going overboard with blow-ups in your yard and things like that are definitely frowned
So
upon.
what's that? The National Lampoon thing? We don't want the houses to look like that.
That might be pretty cool, actually.
Oh, really? Is it going to sell it? No. He's staying quiet on that one.
No, I was going to say
comment.
something totally off color. So.
You can save that for off air.
Clark, the shitter's full.
Okay, so he didn't. Well, I guess this show's not made for kids, so it's okay.
Yeah.
All right.
All
So
right.
what are some of those quick fixes then?
The usual stuff: curb appeal, carpet paint, make sure everything works. I'm an advocate of a pre-inspection these days, getting your house pre-inspected. That way you know what things could be hiding somewhere that would torpedo the deal.
Mm-hmm.
It's relatively inexpensive and makes you proactive. I think we talked about that a lot today.
Yeah.
So, and then Gwen said it all afternoon here. Meet with an agent,
A professional.
Educate agent,
yourself.
someone who sells.
Educate yourself. I like
Yep,
it. Yeah.
and educate yourself. And the markets are super hyper local. So finding someone that works the area that your house is in, and then sells some real estate and has good reviews.
Okay.
Yeah.
Okay. All right. That was very simple. Keep it light. Keep it breezy, and less is more when it comes to the decorating.
For sure.
Okay. All right. Great show. But before we sign off, I want to sell my house, Troy. How am I going to get hold of you?
Okay, tendhometeam.com on the internet. Call or text anytime, 206-504-3660.
All right. So this show's out. We've got open enrollment. Gwen, I'm panicking. How do I get hold of you?
It's January 14th.
You can come to Woodinville Chamber, any events, or you can reach me at gwen@benefitsolutionsnw.com or even gwen@anythinginsurance.net. So we'll give you a couple of options there, but you can reach me at 253-617-4692.
Perfect. And I would say we know Gwen well, so don't be frightened to call her. If she can't help you, she'll find someone that can, but she's
Yes.
definitely there to answer your questions.
Absolutely.
And if you can't remember, just call us and we'll send
Will,
it. to you.
exactly.
You know where to find me.
Yep.
All right. Well, that is it for this week. If you like the show, don't forget to like and subscribe. And if you're watching on YouTube,
Ding the dinger.
all right, folks, that's it for this week.
All right.
Thank you,
I'll
guys.
see you soon.
Thank you.
Bye.